Fact, I think so.
Go, Brian.
Welcome to European Patient Rights Day 2022. This conference is on the future of a healthy Europe. It's about taking part in the decision-making process on health priorities and between new challenges and gaps to fill, what's missing and what should we expect. I'm Brian Maguire. I'm a journalist with Euractiv News Agency in Brussels, but I'm coming to you from Washington, D.C. today. So you may hear me say good morning to some people, that's why. Just some quick housekeeping. We have the hashtags EPRD 22, EPRD 22. Use this for social media. Social media team will respond to you and keep the conversation going that way as well. Also, hashtag European Patient Rights Day. European Patient Rights Day as well. So use those two hashtags and you'll keep the conversation going through the program today and also tomorrow as well. There won't be a Q&A button as you may be used to having when you use Zoom, but we will use the chat function today for Q&A. So put your questions, your comments in the chat section and we'll be paying attention to those. We'll bring your questions and comments to the panelists a little later on as well. So don't hesitate to do that until the moment. You can do it all the way through the discussion today as well. Our team will be paying attention to that. Just before we kick off, just a shout out to all those that I can see have joined us as well. So we have from the Azores, from Serbia, we have Milan, Macedonia, Spain, Bulgaria, Netherlands, Sweden, Portugal, Kosovo, and I'm sure I'm missing some, Estonia, Romania, and a few others like Finland I can see too, Germany, Greece and Albania. Those are just the ones I can see. So good morning, good afternoon to all of you. And just before we start, if any of our panelists have any connection issues, just don't worry, restart, we'll bring it back in the conversation. And for those who are joining us today, please also join us tomorrow as well in case you weren't aware of that. So stay with us for the rest of the program. Now, to kick us off today, we have a video message from Stella Kyriakides, the European Commissioner for Health and Food Safety.
The day dedicated to the rights of our... Ladies and gentlemen, it is with immense pleasure that I open today this conference on the occasion of the 16th European Patients' Day. The day dedicated to the rights of our patients, that should, of course, be celebrated and adhered to every single day of the year. Dear friends, the COVID-19 pandemic has revealed a stronger need to work harder together to build stronger health systems. And our European Union's latest health initiatives aim exactly that. Europe's Beating Cancer Plan, the pharmaceutical strategy, the European Health Data Space, and building a strong European Health Union all have at least two aims in common: to offer Europeans a healthier future and to put patients first. I'm therefore glad to see that these correspond to the themes of your 16th conference, which I'm delighted to address today. For the EU, and for myself personally, equal needs-based access to health services from prevention to aftercare is key. Access to those services depends on many factors, not all health-related. And as we all know, it's often vulnerable groups that need our help most. Even now, millions of Ukrainian refugees are fleeing under Russian aggression. Among them are children, women, elderly people, and people with chronic physical and psychological conditions. Many have lost loved ones or have suffered violence, facing a very uncertain future. People facing immense physical and mental exhaustion and distress. In response, the EU takes all possible actions to help them and the countries welcoming them. We are supplying medicines, vaccines, and medical equipment through our civil protection mechanism. We are training professionals and coordinating networks of support. We are providing cross-border medical care. And we are helping coordinate transfers of patients, including children with cancer and other vulnerable patients, to member states for treatments. Ladies and gentlemen, building a healthier Europe involves us all. Over recent months, we've been gathering the ideas from you, Europe's citizens, during the Conference on the Future of Europe, now approaching its conclusion. For its part, the Active Citizenship Network has lived up to its name, notably through EU webinars that have rightly highlighted health as a common good. It's clear to me that citizens want the EU institutions and member states to join forces on many common priorities, including actions to promote healthier lifestyles, including sustainable and affordable food, investment in stronger, more efficient, more resilient health systems, a broad understanding of health, including mental well-being, cooperation on major challenges like pandemic preparedness and antimicrobial resistance, and equal access to innovative medicines, treatment and care. These pertinent recommendations and the insights your conference brings today will help the healthier future we all want, with patient needs and rights at its very heart. I therefore wish you all a most successful conference and a very good European Patient Rights Day.
Our thanks to Commissioner Kyriakides. She set the tone. We're looking at resilience, preparedness, and the holistic approach that healthcare demands and which our citizens expect as well. Now, let's hear from Mariano Voto. He's responsible for EU affairs at GT Initiativa, the Active Citizenship Network. Mariano, good to see you. Over to you.
Thank you, Brian. Good afternoon and welcome also from my side to the European celebration of the 16th edition of the European Patient Rights Day. The third one realized in digital format, and look forward to organize the next one, of course, again at the European Parliament, the house of this celebration. As you probably know, Active Citizenship Network, the European branch of the Italian NGO Cittadinanza Attiva, has promoted these multi-stakeholder events since 2007, and as its director, I'm very honored to celebrate its anniversary. This edition is divided in two sessions, both linked with a single message, which I believe brings together civil society, patient advocacy groups, and relevant stakeholders. That is the necessity to take part in the decision-making process on health priorities. Tomorrow's session will offer us the opportunity to assess the mission of health within the national recovery and resilience plans. Today, instead, we are invited to reflect on whether the need to build a strong European health union, as proclaimed by the President of the European Commission, is a concrete perspective. We will discuss about this, keeping in mind, as already said, what is emerging from the Conference of the Future of Europe, which has represented a unique and timely opportunity for European citizens to debate on Europe's challenges and priorities. Since its launch last May, several consultations across the continent were made, and all European stakeholders, civil society representatives, were invited to express their expectations. The conference, with this structure on panel, plenary, and web platform, despite its limitation, represented an exercise in civic participation, with respect to which European institutions will soon be called upon to make public commitments. Faced with this opportunity, a movement of civic participation, such as my organization, could not remain indifferent. This is the reason that we have launched, as a follow-up of the last European Patient Rights Day, a cycle of European webinars already mentioned by the Health Commissioner, titled Health at the Heart of the Future of Europe, with initiative in June, July, September, December, to align the priority of health as a common good. All initiatives were realized in the framework of the Member European Parliament Interest Group, European Patient Rights and Cross-Border Healthcare, and all hosted by the Future EU platform created by the European institutions to enable citizens across the European Union to share and exchange ideas. We can therefore consider today's appointment as the natural prosecution of our commitment in this area. And in fact, also this initiative is hosted by the Future EU platform, with the objective to send to the European institutions suggestions coming from the initiative. The conference nears finalization of policy proposal, and during the final plenary session scheduled at the end of this month, proposals are expected to be approved. We believe that among the lines of the recommendations that emerge from the conference, there is room, and before the deliberation expected in May, still time to make further suggestions to the European institutions. For example, on access to care with the objective of reducing health inequalities. In particular, the European Citizens Panel on Climate Change, Environment and Health finalized 51 recommendations. I don't want to mention all, of course, but just to highlight some topics. Some of them involve the need to ensure equal access to high-quality healthcare and suggest greater harmonization and integration at European level, also following the COVID-19 experience and its impact. Other recommendations range from calls from increased investment in the area of mental health and medical research to address current health challenges, paying particular attention to the aging population, to calls for investment in preventive measures, including promoting healthy living and combating known causes of health problems such as air pollution. Without going into the details of the recommendations that have already emerged, what else is worth highlighting? Between new challenges and gaps to fill, what is missing and what to expect? We ask this to our appreciated and qualified guests. From my side, only two considerations before to finish. The first one is linked to the report published following the work of the conference. More than 2 years of COVID-19 pandemic, during which the health of each one of us has been jeopardized as never before, do not seem to have been enough to increase among citizens the need for a European health union. If it is true that the topic of health was among the least discussed in the context of the conference. Is it probably a paradox or a signal one should pay attention to, or a missed opportunity? Probably a mix of everything. We certainly feel that we have done well both in advocating for health issues in the way I've mentioned and in dedicating to these topics today's session. My second consideration is related to the war in Ukraine. In order to give a strong signal of attention and closeness to the Ukrainian population, today we have hosted two testimonies, significant, even not direct. We truly wished to host the voice of the Ukraine Patient Association, our historical partner, but we have no news of their leaders. The feeling is that in a global context of such continuous evolution and growing uncertainty as the one emerging from the combination of pandemic and war, legitimate recommendation and priorities, of which we will soon speak, on the one hand seem to be born already old, surpassed by other priorities that until yesterday were not seen as such, because we took them for granted. And on the other hand, the same legitimate recommendation and priorities seems to be so futuristic, so far from being realized in the short term, because in meantime we have other more pressing, basic, vital priorities. In between, there is the dramatic awareness that for 2 years now, the perception of our level of security has been considerably reduced, and that the consequences of this are suffered as too often happens first and foremost by the most vulnerable target group, vulnerable social categories, minors, the elderly, the patients. It seems so banal to say that this is the main precondition to guarantee health and the respect of all rights, including the civic and patients' rights. Thus, let us first of all wish for a future in a Europe at peace. Finally, of course, let me thank in advance the panelists, the representative of the European institutions, and of course, Brian, the journalist, producer, broadcaster, that I want to remember with a great experience of European politics, business, having agreed to chair for the third year in a row the conference. Thank you all once again a visual, worthwhile, interesting event.
Thank you, Mariano. Very kind, as always. Good to see you. And we'll have Mariano back to wrap up with some concluding remarks towards the end of the discussion this morning as well. Now, we're going to have two short presentations as well, then no PowerPoints, but they'll present on how to build more accessible healthcare systems. Our first speaker is Christian Kaiser. He's the President of Standing Committee of European Doctors. And then we'll also have Mauro Mari. He's the Director of the Welfare Observatory at Luis Business School and President of the Commission of Fiscal Expenses at the Italian Ministry of Economy and Finance. Christian, can I bring you in first to address the conference today and give you the floor, sir?
Thank you very much, Brian. Thank you for the invitation. We're very happy to join this conference from the point of view from European doctors. And there are three topics I want to just address with you on thinking about a more accessible healthcare system. First of all, for us is the free movement of patients in Europe. One of the great benefits of European integration is that EU citizens have the right to access healthcare in other EU countries. In general, we believe that patients should have the right to access to appropriate and professional healthcare for everyone, and not only in an EU country where they're insured. Patients are entitled to healthcare delivered in accordance with good clinical practice as defined by that medical profession in that country. And therefore we have this EU directive on patients' rights in cross-border healthcare, where people can access information and available healthcare in other European countries. European Commission is currently evaluating this directive, and some of our members have participated in interviews and written consultations. The public consultation outcomes showed that the three main reasons for seeking healthcare abroad were that the specific healthcare services were not available in their own home country, better quality of care and treatment, and sometimes long waiting time in their own country. However, more than half of the respondents agreed that there are barriers of cross-border healthcare, especially for patients who have to pay upfront for treatment and then seek reimbursement, lack of information, but also language barriers. And we strongly believe that these barriers need to be tackled at national and European level. Then from that, the second point is proper reimbursement of healthcare costs outside patients' original country in Europe. It's also a great benefit that patients have the right for reimbursement. And we already, before the 2011 directive, advocated that healthcare was in place for all patients and that they should be entitled to proper reimbursement. The recent European Commission's public consultation focused on that, and it showed that the majority of people is aware that patients can get healthcare costs incurred in other EU countries. But it also showed that the EU schemes for reimbursement do not fully meet patients' needs on accessing healthcare in another EU country, and gap still persists. The consultation also revealed that people feared that there would be incomplete reimbursement. The issue of prior authorization, that's a formal permission from the EU member state of affiliation where the patient is insured for the assumption of planned cross-border healthcare costs, are then a problem. So the study on that concluded that the way these prior authorization procedures are implemented differ greatly between the EU member states. Therefore, the Commission developed guiding principles, but they also thought that we had highlight the importance of clear and consistent information on these prior authorization procedures. Then the final topic, the accessible and compatible healthcare systems in Europe, where the patient should be in control of access for other healthcare professionals. For us, a very important topic because the access to healthcare is a key element of social protection policies. Unfortunately, there are still gaps in the accessibility of healthcare across the EU. Main barriers are costs, waiting time, travel distances to reach medical care. These barriers are prominently especially for certain groups such as rural, peripheral populations, the elderly, refugees. You can think of many groups for that. There are also challenges related to financial resources and the distribution and availability of trained healthcare professionals. The Mutual Recognition and Qualification Directive tries to ensure that these qualifications of doctors across Europe are the same and recognized in all EU countries. Making this standardized makes it better. It also aims to ensure that the treatment will be equal, at equal quality and equal costs. One of the citizens panels of the Conference on Future of Europe recommended that the EU safeguards common health standards and same training standards, same certifications for healthcare professionals across the EU. Without the common standards, the differences could lead to even more unbalanced situations across the EU. So it is useful that the European Commission is evaluating the EU Directive on Patients' Rights in Cross-Border Healthcare. It's necessary to know the barriers to cross-border healthcare and to healthcare in general in order to remove them and improve access for better patient care. However, there are many factors to be improved and actions to be taken, especially to reduce inequalities in access to healthcare, both between and within countries, because still large shares of the EU population, in particular vulnerable groups, face barriers and therefore do not receive the care they need. I'm looking forward to hearing what kind of ideas this conference will have to set forth. Thank you.
Christian, thank you so much. Setting out clearly the work that's still to be done in Europe as we move towards something which resembles a true health union as well. Now let's bring in Mauro Mare. He's the Director of Welfare Observatory at Luis Business School, as I mentioned, and President of the Commission for Fiscal Expenses at the Italian Ministry of Economy and Finance. Mauro, how are you?
Very good, very well. I am in Normandy, not in Rome, so there is a very beautiful sunshine and quite exceptional in Normandy. So anyway, thank you, Brian. Thank you, Mariano. Thank you very much for the invitation. Don't worry, I have 5 slides, but I'm not going to present any PowerPoint, and I will maybe give later on if someone is interested. Let me start my timer, so Brian, I'm to be sure that I will be in 5-6 minutes, not more. So let's start. My key point of my speech is to discuss a little bit the health expenditure as an investment, because in most of the usual treatment, especially from an accounting point of view, you mentioned, Brian, I am a professor of public economics, so most of the health expenditure is not considered as an investment, but for most current expenditure. The problem is that I think that more and more health expenditure tend to have an obvious investment component. In this sense, it produces multi-year benefits and that last more than 1 year. For example, COVID-19 has clearly highlighted that healthcare is a fundamental investment for any country and increase the economic and sustainability of any nation. For example, the value of human life, the life in good health are key elements for growth potential. The Commissioner just mentioned that health is, I'm quoting her, is a common good, and also there is an element of investment. So I don't think that we can deny this important element that from health expenditure, from a share of health expenditure, there is a strong enrichment of the physical, human, and technological capital stock of any country. And this is true not only, I will do 2 examples, vaccines and ATMP, the advanced therapy. The problem in this case, especially with ATMP, is then how can they be economically accounted for? What is the correct method to understand, to account health expenditure? Because I was mentioning before, up to now, health expenditure is for the largest part considered as a current expenditure. Now, in my discipline, this discussion is a very old issue that in the last 3 centuries, that is to say the distinction between capital and current and capital expenditure. Usually expenditure is current, I'm quoting, is the quotation mark, is the purchase of goods and service whose benefits are exhausted in the accounting year in which the expenditure takes place, close mark, quotation mark. On the other hand, expenditure is an investment, that is to say is a capital account, should be right in a capital account, if affect several years, if it produce benefit for many years. Now, there are general rules at the European level made by the European Commission, especially by Eurostat, that say that investment expenses identify all expenditures that again, quotation mark, directly or indirectly affect the formation of national physical and human capital. So this is not very easy topic. Anyway, ATMP, I will make only the case of ATMP in 5 minutes. ATP expenditure, ATP therapies they show a clear element of investment. They have a high temporal asymmetry between the emergence of costs that tend to be upfront and benefit that spread all across the time in many years. Second, they produce direct and indirect benefit over time. For example, a reduction in healthcare costs, the consumption of hospital, drug consumption, but not only this directly related consumption, healthcare consumption, but also in terms of value, the increase in life expectancy, the improvement of the quality of human life, and so on. So, going to the conclusion. In the last 30 years, we have had three important changes in the European system of national account, I mentioned before, made by Eurostat. In the 1993, Eurostat decided to include, the European Commission decided to include software, mine exploration, artistic expenses, and valuable, and so on. While the more important things, in 2008, in 2010, the European system of national account decided to include as investment, decide to consider investment, all the R&D expenditure, and especially military defense spending. All the military defense spending is considered as investment. Just to make a bomb or a bullet is an investment. A bullet is fully consumed in the process of shooting, is completely destroyed, and consider a bullet an investment. It sounds to me as an economist quite weird. Going to last slide, I think that the time, as I am 5 minutes and 6 seconds, the time has come to review and update the current European Accounting Convention in a very extensive way. I think that an increased share of current expenditure is necessary to increase a national capital economic stock of any country. And in the end, the accounting criteria we are discussing, we are dealing with, are the result of some compromise between economists, between accountant, and they are essentially an accounting convention. It can be updated, it must be updated, not only according to the course of technological condition, but also they have to reflect, and I will stop, the common feeling of nation and people of the community. They are not holy tablets of the law, given from somewhere. They are a compromise, and I think after COVID-19, after the war, after what we had in the last 2-3 years, I think that we have to recognize that a large part of the health expenditure is an investment. Thank you very much, Brian.
Mauro, thank you so much. Thanks for being so timely also. I wish all my guests and all my programs were quite so punctual. Thank you. Stay with us. Audience, send in your questions, your comments as well. We'll bring those in, especially during the next part of the discussion. We're going to begin our discussion panel in just a moment, so don't hesitate. If you are putting a comment, please, you don't have to, but it's good for us to see who you are and who you're representing, where you're coming from as well. So give us a quick heads up on where you're coming from, and try to keep your comments, your questions short as well, and we'll give as much opportunity to our guests, our panelists, to answer you on those as well. So let me introduce the topic of our discussion today. We're going to debate with the EU institutions on the main issues that emerge from the recommendations of the citizens panels and from the health initiatives organised as part of the Conference on the Future of Europe. The conference, of course, being a wide-ranging fact-finding, opinion-taking exercise to understand what Europe should look like for at least the next generation as well. And part of that, a very important part of that, is the healthcare dimension as well, which touches so many other elements, as Mauro has led out as well. So we have 4 guests today, and each of them they're going to have about 60 seconds just for an elevator pitch to set out their key remarks, and then we'll begin the discussion as well. The first of our guests today is John F. Ryan. He's the Deputy Director General for Health, Director General for Health and Food Safety, the European Commission. We also have with us Tomislav Sokol, a member of the European Parliament and from the European People's Party from Croatia, and David Samek. He's the Network Director at the European Health Futures Forum and former chair of the Wellbeing Economy Working Group and knowledge partner of the All Policies for the Healthy Europe initiative as well. We have Eric Tizier. He's the Head of Government Affairs Europe at TEVA Europe. And we also have Boris Azayas. He's the Director of Public Policy Europe for Canada as well. And he's from MSD. So for each of our panelists, can I ask you just a quick opening remark, and then we'll open the discussion as well. John Ryan, can I ask you to kick off? About 60 seconds or so.
Yes, so it's very nice to be able to speak about the ideas that are emerging from the Conference on the Future of Europe. The ideas which we've seen so far are very much aligned with the Commission priorities. We have made a number of legal proposals for a European Health Union, which I'll speak about in more detail later, but also this feeds into the response to COVID and to the current situation in Ukraine, so better preparedness of our health systems. The Europe Beating Cancer Plan is another flagship initiative, which we can go into some detail on. The EU Pharmaceutical Strategy, which is something that's in the pipeline as well as the European Health Data Space. All of these initiatives really go in the direction of the ideas that are coming from the citizens panel. And I would say we're quite lucky as well in the sense that we have financial instruments which are quite strong compared to the past, both from the Recovery and Resilience Fund, from the EU for Health Programme, from our research programs and so on. And I think that also gives us the mechanism to actually implement some of these ideas on the ground. Thank you.
John, thank you so much. Tomislav, over to you. Can you unmute for me, please?
Thank you very much. I hope you can hear me and see me. So I will try to be short in these opening remarks. So there are a lot of inputs and suggestions from citizens within the Conference of the Future of Europe regarding health. So I cannot go into detail on each one of them, but I can group them in two parts. So one are those, and I'm a lawyer, so this is something that I'm always focused on. So what actually we can do with them. So the first group are the ones which require the amendment of the treaty in a way of giving more powers in the area of healthcare to the European Union. So taking over more powers from the member states and giving them to the EU. And the second are amendments to the existing legislation and policies without changing the treaty. So I think I will be perfectly honest. I think those the amendment of the treaty only for the reason of healthcare and having more powers of healthcare is not realistic. So definitely there is no. I do not foresee a change of the treaty only for this topic. So if we amend the treaty, this will have to be part of the overall big revision of the treaty and reform of the European Union. And we do not have currently a consensus within the member states and within the European institutions on how to do that. So amendment of the treaty, I think, is off the table. However, I believe that we have a lot of possibilities, some of which have not been explored, to use the existing powers to have more concrete actions on the European level and to resolve those health problems which member states cannot resolve by themselves. So better preparedness for future crises, better provision of cross-border healthcare, better exchange of data through European health data space, more funding to reduce inequalities in healthcare provision between different member states. So I think that we can do much more with the powers that we already have. And I hope and I believe and there are some initiatives that I will be talking about in more detail about how we can do that.
Tomislav, thank you so much. Excellent summary. And let's go to David. David Samek.
Thank you very much. Yes, I want to come from a slightly different angle, thinking about some of the threads in the citizens' panel responses, which for me represented a real concern that I think that the COVID experience also highlighted really, which is there are a number of things about health policy which we have been aware of, but somehow have not been able to progress sufficiently. And the particular ones, and some of them have been touched on already, health equity. The fact is things are getting worse, not better. It's been known about for years now, and it's been seen as a priority, and yet health inequality is widening, not improving. The second one, I think, is I would mention, although it's not mentioned as under that label, health literacy. There is quite a bit about education and better education on health, which obviously was a crucial aspect in the pandemic. And what that highlights for me is something about not thinking in silos. You know, the citizens talk about better education in schools, but there's a real difficulty, isn't there, about different areas, talking across the boundaries, as it were. And I think that also applies, of course, to again, it's been mentioned, the holistic approach. We're only too well aware that health is impinged on by the environmental issues, by the nature of food and so on. And citizens are clearly aware of this. Now, I know the Commission is paying a lot more attention to this, but nevertheless, at a member state level, I think actions being taken are still held back because of other vested interests making this difficult. I think these are all real concerns for me, and I think citizens are picking up on them. And it's very reassuring in a way that they are seeing things much more widely than just in a narrow focus of their own health or their families. Thanks.
David, thank you so much. We're going to pick up some of those topics in just a moment as well. Eric Tizier, over to you.
Thank you, Brian, and I'm very pleased actually to be on this panel today to discuss what patients and citizens of Europe expect from the future European healthcare. I'd like to focus on a different type of angle, if that's okay, which relate to manufacturing resilience of essential medicines. To start the discussion, notably, I would like to share with you the results of consumer research that we conducted by reaching 3,000 chronic patients across 6 European countries, a survey that we initiated last year as patients were going through the second and even the third wave of the pandemic. And we wanted to understand the implications that the pandemic had on patients' experience regarding the availability of their medicines, as well as their expectations regarding the resilience of the healthcare systems. So some key highlights that I would like to share for the discussions moving forward. 90% of the patients surveyed didn't experience more shortages, but 73% faced some access to healthcare challenges at some point. In here, I'm talking about doctor appointment being canceled, for example, or surgery being postponed. 76% of the respondents perceive Europe as being too dependent on other regions with regard to essential medicines. 70% wants to know more about where the medicines are being made. And the majority think that the European industry is strategically important to ensure the stability and reliability of the healthcare system when it comes to essential medicine supply. And 84%, and that's a big number, right? 84% want their government to support manufacturing investment in essential medicines. So I think the survey shows a great concerns about Europe pharmaceutical dependencies for essential medicines. Let's just recall that, for example, when it comes to ICU, we are talking about 80% of those medicines being made generics. So I'm going to stop here, just, food for thought for the reflection, and happy to come back for during the discussion.
Yes, you'll be back, don't you worry. Thank you, Eric. Okay, Boris Zayas, over to you.
Thank you, and hello, everybody. Thanks a lot for having me on this panel. And hello to the colleagues and people I've been working with in the past. So clearly on this, Patients' Right Day, I wanted to stress the fact that there has been a lot of progress, and we should continue progressing towards making patients more involved in the whole health system cycle and health policy cycle. And I think the Conference for the Future of Europe with the working groups and the reports is an excellent step forward. On our side, MSD, pharmaceutical company, we've been involved in health literacy for more than 10 years, really putting it on the health policy agenda for more than 10 years. But also something that we've been keen to advance is also health system literacy. So health literacy is very important, but also we need health system literacy, because quite often that is what's missing to have a fully informed and sophisticated conversation in terms of improving the democratic process for health policy design. one of the key challenges that nevertheless we will continue to face in Europe in order to deploy truly equitable access to healthcare is wealth differences. There are significant differences in GDP per capita. There are significant differences in relative health spending. So even we see that the countries in Europe that have a low income or low GDP per capita, they even spend a lower share of their GDP on healthcare. So we're in front of significant gaps to bridges, and it's not going to be just a paper exercise. And I think that the points made previously by Mauro Mare are extremely important on how to really make the case for health as an investment. That is a clear stumbling block. And if there's something that could unleash really a true EU level health system policy, more equity and better and more equal access, that would be found on how we budget for healthcare. My last point here would be to say that, whatever we do, we should be measured along how much we care and how much we manage to improve healthcare for the most vulnerable populations. MSD, we've launched an initiative called Nobody Left Outside back in 2017, really to focus on the access to healthcare, basic healthcare for the most marginalized communities in Europe. I'm talking about homeless people, migrants, prisoners, sex workers, LGBTQ, and other groups that are highly stigmatized, and this prevents greater access to healthcare. There's been great progress. The DG Santé, the European Commission have been focusing on that, WHO, Euro as well, and we've seen a lot of movement in this on this plan during the COVID-19 crisis. And I'll stop here.
Boris, thank you so much. We'll come back to those points in just a second as well. Let's go to Tomislav first of all. I want to pick up on an element. You didn't use the word cohesion, but you're talking about mechanisms that we have without having to revise the treaty, adjusting the policies. Now, the Commission hasn't to this point had executive authority over the health dimension, and that may change as well, and that kind of has tied its hands, but there's a lot on the table which is happening now which wasn't there before. In terms of what we've heard from all the other panelists, and keeping in mind we're asking what's missing and what should we expect as an overall theme for the discussion, where are you optimistic that we can achieve greater cohesion, we can reduce health inequity as well? And David picked up on the fact that things are getting worse instead of better as well. Where would you push first? What are the levers that you're most encouraged about can produce the best results more quickly? Tomislav.
Thank you. This was precisely the topic of my report in the Regi Committee. So it was about how to use cohesion policy funding to reduce these inequalities in provision of healthcare. Because now we have the EU for Health program, which is 12 times bigger than the previous budgetary program for health in the previous 7 years. But still, the biggest source of funding for healthcare from EU budget is and will remain the cohesion policy. So in the previous budgetary period, around 25 billion euros was spent from cohesion policy funds for healthcare. So this is a very important instrument. So what I'm advocating in my report is to have even more and stronger financing from cohesion policy for healthcare to achieve concrete objectives. But what I think is even more important is to actually have much better measure of the outcomes that we how this money is spent, and to have health outcomes, like for instance, more survivability of cancer, childhood mortality and survivability, etc., infant mortality. So to have these health outcomes to use as benchmarks when evaluating how the money is spent. So actually not just to build new hospitals and buy new equipment, but to actually see whether these new hospitals, new equipment, new resources are actually contributing to reducing the disparities and in achieving better health outcomes in member states. Also, one especially important area which needs to be mentioned is not just infrastructure, which is usually the focus of EU funding, but also workforce, because in many member states, like in Croatia, like in Bulgaria, Slovakia, Romania, etc., we had a big outflow, big migration and brain drain of health personnel to the western and northern parts of the EU. So this is something that needs to be changed. So we have to use EU funding, like European Social Fund, to finance more subspecializations, to have more, to use EU funding to create better working conditions for healthcare personnel, so that they have motivation and incentives to stay in their member state. And my second very important point is also the initiative that I've been working on, and that is the joint procurement of expensive medicines. So the same way as we had joint procurement of vaccines, which was used to strengthen the negotiating positions of the member states towards pharmaceutical industry and to reduce prices, we can use the same approach for very expensive medicines, which are still a big financial burden on the budgets of national healthcare institutions. So use joint procurement to have better bargaining position, to reduce prices of new, especially new and expensive medicines, and by doing that, to create better access for patients for these expensive and innovative medicines in all member states of the EU.
Thank you, Thomas. So, John, we had some bumpy starts as we worked out what a vaccine procurement process would look like, and the idea that we were going to be stronger together. In the end, that proved to be true, and that it bolstered the argument that a health union can produce greater good for the most people more quickly as well. Now, you have a lot of tools available. The Recovery and Resilience Fund as well is just one of them, and benchmarking seems to me something which is going to become more politically sensitive. Nobody wanted to invest more than 2% in NATO budget until we had this issue on the borders of Europe, and now suddenly that's not such a big ask. Nobody wanted to invest in healthcare systems any more than they had to until COVID came along as well. How is the Commission going to keep member states in check and focused on investment in healthcare to level up, to reduce the health inequality across the union? Because part of this as well is not just about healthcare, it's also about the economy and disparities in the economy if we don't get this right too. So if we look in the long term, so how is the Commission going to keep in check member states and make sure the right investments made at the right time? John.
Thank you very much. So a few comments. First of all, a lot of momentum has arisen because of the COVID outbreak. Momentum which was not there just a few moments before the COVID outbreak began. And the example given by our colleague, the member of the European Parliament, is correct. I mean, the size of the EU4Health program is, I think, itself an indicator of a recognition that there was a problem in the size of the investments in public health in particular. So a huge increase in the available budget for the research program on health and for EU4Health is, I think, an indicator in itself of a recognition that there was a need for investment. This is a 7-year program, so it's a 7-year investment window, I would say. However, given my previous experience in public health, I would say that the moment that a crisis goes over the horizon, a new crisis arrives. And the proof of that is with the situation in Ukraine, because the amount of attention being paid to an ongoing worldwide pandemic of COVID has declined considerably since the Ukraine war has broken out on our borders. And this is a natural political process as well. The danger is, of course, that when you take the focus off the health crisis, then the attention moves to something else. And we were talking about bullets and bombs earlier on. I mean, it's quite clear that there will be a lot of pressures on national budgets following the COVID outbreak, but also following the Ukraine situation, because there have been defense investments, there have been investments now in dealing with the flow of 4.5 million refugees. So all of this makes it very difficult to plan. And if we do face an economic situation which is maybe a downturn in our economies, there will be pressure on health budgets, regardless of whatever the European programs provide for. That's why the Commission was proposing structural changes in our legislation. We've strengthened the mandates of our agencies. You were talking about medicines earlier on. I mean, the European Medicines Agency mandate has been strengthened. We're proposing to strengthen our legislation on cross-border health threats. We're also doing this at the international level through the WHO and the negotiation of a pandemic treaty. And we, of course, have strengthened the surveillance system in the European Centre for Disease Prevention and Control. Turning now to the available budgets, I mean, this is something we can come back to. It's not only a question of the health programme with a budget of 5.3 billion, or the research programme with a budget of 8.25 billion. So these are large amounts of money. But also the recovery and resilience funds. And just to tell you that we've already spent 37 billion euros from the Recovery and Resilience Fund on health projects for 2020 for 22 member states. So I'll just repeat that figure because I think it's significant. 22 member states have put in their plans for the Recovery and Resilience Funds. They have been approved. And 8% of the total of the resilience funds, 8% has so far been given to health projects. So this is not a negligible investment in the future. Whatever, you know, the national budgets have to face in terms of tightening in the coming years, nevertheless, the European budget is nevertheless available to be mobilized there. And of course, there's a lot of other initiatives which I could talk about on improving the flow of healthcare workers and trying to reduce the inequalities in care between member states. For example, through the creation of a cancer inequalities registry, which is part of our cancer plan. Okay. So you were talking about measuring earlier on, how do you measure inequalities? Great sensitivity attached by member states to measuring anything, because of course it puts the spotlight on the best, but also on the worst.
Yeah, we wouldn't want accountability in all this. That would be terrible.
That's not a surprise. So, I mean, we were talking earlier on about the structural indicators and so on, and how these are reported to Eurostat. It's a very, it seems like a mechanical system, but in fact, it's a very political system, and sensitive system.
Let me move to Eric just to talk about systems a little bit as well. Eric, I'm guessing the 70% figure from your study for people who wanted to know where the medicines are coming from. This is at least in part inspired by the vaccine issues that emerged, particularly at the beginning of the pandemic as well. But it does play into the narrative that Europeans trust their own system more, they trust their home countries more. And how do you see, you know, the structures that John has set out, all this? If there's no medicine, the medicines are a big part of the budget process as well here. If the medicine supply chain is not working properly, we not only have a financial burden, which shouldn't be there, but also we have a technical inability to deliver the right medicines at the right time across Europe as well. You know, what do you hear from patients, from healthcare organizations, from hospitals in terms of the gaps? What's missing and what can be improved here?
Yeah, so Brian, you're mentioning the vaccines, and you're right? So the vaccine situation has certainly impacted, let's say, the outcome of the survey that we've made. But let's not forget that in 2020, we had actually also an issue with paracetamol, where actually India closed its export to Europe for medicines which, you know, like we took for granted. And then we all realized that Europe was totally dependent. So I think the question is up to where actually can we afford for Europe to depend on third countries when it comes actually to essential medicines? I'm very pleased actually that you asked the question with regard to, you know, like where does medicine fit into the, let's say, the whole healthcare system. And when we talk about, you know, health expenditure as an investment, I think the question is how much do we want to invest into our medicine supply chain, and especially when looking at essential medicines. Let's not forget that sometimes those medicines, let's say, you know, like cost no more than actually a pack of chewing gum. Let me give you an example. In Germany, the cost of what we call a defined daily dose for generics was 17 euro cents 10 years ago, and now we are at 6 euro cents today. So the price has been reduced by 2/3. And this is due actually mostly to the procurement system that are focusing just on cost, I would say only. So we even have actually some, let's say, bidding in Germany at 0.05 cents. So this is not sustainable. It's certainly not when actually you want to produce your medicines in, let's say, in Europe. So I think what needs to be addressed is really the imbalance between the push for investment. We're investing in green technology, we're investing in security of supply, we're investing into the fight against counterfeit, which is normal, and this is our responsibility, and glad to do it. But then the question is, where do you want those investments to take place? And the risk that it creates if we are investing elsewhere, especially when it comes to a public health crisis, as we've seen, the past few years. So I think what we need to address is really actually to solve the dilemma between our own economic sustainability and the current political call to invest in Europe to make the EU's manufacturing more resilient, diversified, and competitive. And here, I believe there is, like 3 aspects that could be further looked at. First is actually, and we need the help of the Commission for this. It's actually to stop, like the race to the lowest cost generic. I'm not saying that generics, like needs not to become affordable. This is absolutely not the point. And generics are still here actually to, let's say, to deliver savings. However, actually, we've seen, like the risk if the whole manufacturing is like totally moved towards the east. So how do we balance that? And I think here tender needs to be changed to be much more value-based and actually cost-based. We need a regulatory regime that is also optimized and modernized. Today, our interactions with the regulatory agencies are mainly paper-based. I mean, we are talking about, like the digital space. We are talking about the, let's say, the digital as a key priority for the European Commission. So I think for our sector, this is also key to move in that direction, especially for our interactions with the regulators. And last but not least, I think we need to think about, let's say, to facilitate access to EU funds to attract investment in specific technologies, manufacturing capabilities, in order to remain competitive and to make sure that we get the medicines that we need when we need them. Let's make sure that we are not going to wake up, at the next public health crisis and realize that most of our essential medicines have left the continent.
Yes, I don't want to dwell too much on this today, but the idea that we're not preparing for the future and that the public good in this as well is being neglected because there's a race to the bottom on price, and the disincentive for innovation as well as participation in the market evaporates as well. So we don't spend too much time on that today, but David and Boris, I want you to have a go at a question we have and say to our audience, send in your other questions, your comments now. So Pernilla Gunther, she's a former member of parliament in Sweden. She remarks, is it really the best for healthcare to just add more money without evaluating working conditions for healthcare providers or organizational changes to meet the needs for the patients? I believe you need to see benefits of new treatments, digital tools, etc., and not the least to provide possibilities to self-monitor at the same time as necessary number of hospital beds. David, do you want to have a go at that? How do we focus more on the self-care, the preventative approach to healthcare to build this resilience into our healthcare system?
Well, it's funny you should ask me that because that's I was thinking, there's extraordinary diverse contributions from colleagues so far, but it's simply a reflection, isn't it, of how complex health and healthcare is. But what I felt was missing so far in the discussion, and it follows really from Mauro's introductory remarks about economics and investment, is something we all know about, which is, despite the fact that it has been identified with good science that prevention saves money, the percentage of healthcare spending on prevention is still tiny. And it isn't rising. And I think that's really important in terms of thinking about how we spend, how the Commission or member states spend, when prevention is something that is in everyone's interest, and yet the investment to promote it isn't somehow forthcoming. It's somehow listening to the discussion. It's about the preoccupation with sickness care, which of course has huge financial investments from all sides. But in terms of the everyday citizen, of course, they want to feel if they get very ill, they can go somewhere and they'll get really good treatment. But obviously, there's another side of that, is to helping prevent that happen. And I feel this is such an important issue, and it's somehow always, it tends to get sidelined. I think the thing about self-care, of course, there has been a huge progress, I think, if I understand the question right, from our Swedish colleague. There has been quite a bit of progress, and digital helps, of course, in helping citizens, the well-informed citizens particularly, look after their healthcare better. I think that is an area of progress. But I think the question of prevention and so on is still a major one. I know the colleague from MSD touched on it, but I think there's a lot more we could say about it.
Okay, thank you. I'm going to bring Boris in just a second, and then I want to get a quick word on legislative opportunities there as well, particularly in the context of simple examples like obesity, what we can do in terms of preventive approach there. And but just John wants to come back on this as well. John.
Yeah, just on this issue of prevention, I think it's misleading to quote this 3% figure, which OECD has been developing. It's misleading in the sense that much of prevention can actually be done through other means than direct investment. I'll give you an example. The legislation which the European Union has on tobacco is among the strongest legislation in the world. That doesn't count in the 3%. The information which we have, or the legislation which we have on labeling of food products with the sugar content or the fat content, and also the legislation which we have on things like carcinogenic substances in the workplace, all of this legislation has a macro effect, I would say, on population health. And unfortunately, it's not factored into the calculation of the 3%. 3%, if you like, might be something to do with improving children's dental health in schools or something. That's fine. But my point is that there's a lot of population-wide legislation which you can introduce, and I could multiply the examples for the rest of the afternoon, where the European Union has been quite active, I think, building on member state experiences. And that also needs to be factored into the idea. I don't think it's all a question of direct investment in public health interventions, although that's part of the solution. Prevention is also prevention in all policies. And the cancer plan is probably a good example of that.
Okay. Prevention in all policies. I like that approach. Boris, just your take on this as well. Preventative approach, the maximizing of all policies to leverage this outcome as well, and how we measure this in terms of the results that we're getting as well. How do you see this?
All right, I'll take also Penila's question, which was the starting point. But obviously, I totally agree with what John said, and actually, I would invite all to read Scott Greer's book about EU health policy, everything you wanted to know about EU health policy, which is a great book. And the first edition showed exactly that there is a huge amount done by the EU in terms of health, as long as you don't look specifically at the management of health systems. And so environment law, for example, which John didn't mention, but as he said, there's a long list. So in terms of, pouring more money without evaluation, which was at the core of Penila's question, I think this is a very, very important point. And obviously, it is a problem. Mark Pearson from the OECD taught me once that the problem with healthcare is that we know how to spend money, we just don't know how to cut from spending. We never managed to stop spending on something, which obviously is a problem. And what's I find fascinating, talking from the pharma side, is that medicines, pharmaceuticals is actually the only input into health systems that truly gets evaluated left, right, and center in terms of cost effectiveness, value for the patients, the amount of data that needs to be provided both for regulatory purposes but also for pricing and reimbursement purpose is staggering and is unequal across the health system. But that's okay. But I guess there's something to be done there on improving the measurement of what works and what doesn't work. But it is extremely problematic. But even a very simple process or simple, I'm not sure it's that simple. But one of the problems that handicap a lot of health systems when it comes to evaluation, especially for pharmaceutical inputs, is silo budgeting. Health systems in Europe, most of them, I mean, Germany is the exception. Health systems spend money on pharmaceuticals without looking at how much benefit they get across the system. So it's quite unique. I couldn't come up with any other sophisticated system where you buy technology without looking at what will be the impact on the overall expenditure in terms of output. So if a health system is a factory...
Boris, why do you think that is, though? Why is it just the system so complex? Is this a cultural approach? Why at this stage, with so much data available, that doesn't take place?
Well, I'm not sure there's so much data available, and data in healthcare is very difficult to gather and very difficult to act upon. But it's not so much data here. What I was pointing out is just the fact that in a lot of cases, health systems just don't look at the benefits across interventions of any input, and that's the culture of public finance. There is a budget for this and a budget for that. It's probably very difficult to change, but we should look into this to get progress. I just wanted to clarify a couple of points. One is that in terms of medicine spending, we're still at 15%. I mean, every country in Europe has been converging more or less around 15% of healthcare spent on pharmaceuticals. Obviously, there are places where this number is between 20 and 30%, especially in Central Europe, because the denominator, i.e., how much is spent on healthcare overall, is very low. But the trend over 25 years is that the medicine spending spending on pharmaceuticals has been flat as a relative to total healthcare spending. So it's quite striking that there's a lot of attention for good reasons on pharmaceuticals, but it's not driving healthcare expenditures. And I would really strongly look into the workforce. And as MEP Sokol has mentioned, we really need to look into the workforce, and especially how they move from one country to the other.
We have a question on that actually as well, and we're running short on time, so I want to bring Tomislav in. He wanted to respond, and then we'll come back to that question in just a second as well. Tomislav.
Yes, thank you very much. I would like to just comment on a few points. So first, about the measurement, this is precisely what I mentioned earlier. This is one of the most important parts of my report, to actually see how the EU funding for healthcare from cohesion, but from other sources as well, is spent. I think recovery and resilience facility is also one very important part of this, as was mentioned before. And I think that the condition for spending this money is to actually come up with reforms. And this also includes healthcare sector. So this is one way how we can definitely control what member states are doing in terms of improving their healthcare systems, their performance. The second point that I wanted to make is about prevention. So prevention is, sorry, this is not, I have to move.
You look like that spy that you can't identify in the background.
Yeah. So in the area of prevention, prevention is actually the area of healthcare where EU has the strongest competencies and most concrete legislation, as was mentioned. So we have so apart from the pieces of legislation which were mentioned, I would also like to mention the rules on tobacco advertising and marketing, the rules on indirect taxes on alcohol and tobacco and things like that. Actually, I was member of the BECA committee of beating cancer. This was the biggest point of contention, was actually what to do with legislation on prevention. And because there is a lot of lobbying and a lot of interest groups, I have to say there, But this is definitely an area where big changes are foreseen in the coming period, especially in terms of advertising of tobacco and alcohol and taxation, etc. So definitely this is an area where a lot of things will be done. And the last point about inflow of health and problem of migration of health workforce, this is a big problem. But we have to be realistic. So there was a suggestion in the chat about penalizing in some way those member states which are on the receiving end of this migration flows. Obviously, we cannot do that because we have rules on free movement. Also, we cannot force member states to have more doctors or more places in medical schools because education is primarily a national competence. So member states decide which kind of people will, and which kind of programs, university programs that will finance. But what we can do is to provide financial incentives and for those member states to invest more into their own health workforce and not to use up the health workforce from the east and the south. So I think we have to work both ways. So create better working environment, working conditions for people to stay in the east and the south, but also to create incentives for the other member states, receiving member states, to have more, to create more of the workforce on their own. And also one last point. Somebody mentioned Greer's book. He's my one of my favorite collaborators. We wrote some articles, papers together. So I would definitely also recommend his book about what EU is doing in the area of healthcare, because a lot of concrete EU legislation is not maybe entitled to be focused on healthcare, but in the end has very strong effects on healthcare, like internal market, environment, etc. So all of this needs to be taken into account as well.
Thank you so much. No, we're right out of time. What I want to do is a 20-second final remark from each of you as well. And let's focus on the positive. What do you think, what do you expect to change for the good in the coming years from the future of a healthy Europe? Let's start with John, and we'll go back down to Boris again. John, what should we expect?
I really hope that in the coming years we'll be able to use the additional resources and the improvements in our legislation in order to deliver real change to Europe's health, which is facing the challenges of tightening budgets, shortages of healthcare workforce, and also the issue of the aging of the population.
Perfect. Thank you. Tomislav, last remark, 20 seconds.
So we have a lot of instruments, both regulatory and financial, at our disposal to provide better healthcare for European citizens, to reduce inequalities, better ways of controlling how money is being spent on the national level, but concrete pieces of legislation like the European Health Data Space Regulation, new regulations on medicines, revision of cross-border healthcare directive, the new HTA regulation, etc. So we can use all of this new legislative initiatives to actually have much better healthcare system in the member states in the years to come.
Thank you, David. 20 seconds.
Yeah, no, I also feel positive. I think, following what John said, I think there is more investment than there was before, even though the risk of other crises diverting people to some extent. I think we're on the right path. How far we go down is another matter, but the whole notion as well of the European Health Union is such a positive thing in my view. So let's see what happens.
Excellent. Thank you. Eric, 20 seconds.
Yeah, thank you, Brian. So I really hope that, Europe is going to adjust its policies to remain competitive and help investments in essential medicines manufacturing. I think the commissioner, but also John mentioned the pharmaceutical strategy. So I have big hope on how this is going to deliver. Really defending a level playing field with non-European regions by addressing the economic and regulatory root causes which are pushing investments outside of Europe. So again, let's make sure that we are not waking up at the next crisis with, like some essential medicines missing. So, and to the point of Boris, I think what's very important is to see how, let's say, like the spirit of the cost base is moving much more towards the spirit of the value base when it comes to financing, let's say, medicines and healthcare.
Thank you. Boris, last word, 20 seconds.
Yeah, well, I'm very excited by somehow what happened with the Recovery and Resilience Facility. There's an unprecedented amount of money being invested in health systems. This is tremendous. It's a game changer because health system reform is expensive. And until this, we were mostly talking, and now we can act.
Excellent summary. Boris has also posted a blog link there in the chat. You can have a look at that now as well. Thanks to John, to Tomislav, David, Eric, and Boris. Excellent discussion. Wide range of topics and concrete proposals coming out of that as well. Great to speak with you all. Now stay with us. We have now two testimonies focused on the Ukrainian crisis and the priorities of the EU. So let's bring in Igor Gruskiak. He's the Polish Institute for Patients' Rights and Health Education. How are you?
Fine, thank you, Brian. Thank you
Okay,
for
the floor is yours.
invitation.
4 minutes or so. Okay, Igor, off you go.
Oh, okay. Dear all, I prepared a short text because my English is not so perfect like Brian English or the rest of panelists. So I hope you understand me.
Please go ahead.
Okay. So from February 24th of this year, we all live in the new reality. This reality is especially painful for the Ukrainians. The tragedy of the war we learn about in schools is happening in the front of our eyes, a few kilometers from the border with Poland. As Polish society, we stand in solidarity with the Ukrainian people, and the most importantly, we understand them. For over 120 years, the Polish state did not exist on the maps of Europe. After regaining freedom in 1918, we had to defend in it the Polish-Soviet War. Unfortunately, we lost sovereignty again after World War II for the next 50 years. Therefore, as a nation and its citizens, we know perfectly well what the occupied Russian pursuit of imperialism is. And as a society, we feel what our Ukrainian brothers feel. And apologize for this historical introduction, but this explains very well why Poles are now showing such a wonderful attitude towards the victim of the war. Since the beginning of the war, over 2 million refugees have come to Poland, mainly mothers with children, the elderly, the sick who require support and help. No country could be prepared for such a humanitarian tragedy. Therefore, if it were not for the attitude of Polish citizens, who not only opened their homes, hearts, and wallets, we would not be able to meet this challenge. Most of my friends, family, and co-workers join in providing humanitarian aid in various forms, from offering transport by private cars from the Polish-Ukrainian borders, of providing shelter through volunteering and buying food, to giving financial support. We ourselves, as an organization with completely different objectives than helping refugees, travel with humanitarian aid to Lviv and help other patient organizations in Poland. In the framework of our second organization, the Chameleon mission of social assistance, we carry out volunteer information work at the Western and Central Railway Station in Warsaw. We help people who are lost in finding buses to reception points. We indicate international cash desk for the bus. We help in transporting luggage to the railway stations. We direct people who are hungry to a tent where food is issued. We help guide mothers with children to special zones where they can safely wait for the family's arrival. Within the mission, we also provide permanent and temporary accommodation for 50 people, mainly women with children. Virtually, all the help provided in the first weeks of the war was based on a human need to help other people. But of course, we must be aware that helping to face with this challenge cannot be based solely on volunteering and non-governmental organization activity. All Ukrainian citizens have free access to health services in our country. The Ministry of Health estimated that the increased demand for healthcare service for only 1 million refugees was costing around 50 million euro per month. Now in our country, there are already about 1.5 million people from Ukraine, even maybe more now. Child insurance, medical care in Poland, or problems with getting an appointment to the pediatrician are the most common questions asked by citizens of Ukraine. Our health system before the pandemic was an inefficient system that needed a lot of financial resources. The pandemic has exposed the shortcomings of the system and has limited access to health services in our country. Instead of rebuilding our health system, after the pandemic, we now need to meet the challenge of providing additional care for all those in need who cross our borders. On one hand, there are health needs, and on other side, there is also a problem with housing and with educational, occupational, and social activation. In the face of this tragedy, this is a challenge for all of us. for all European citizens. The systemic solution with the European Union are vital, because without the support of the European community, we will not be able to get through this situation. I'm sure that we will face this challenge hand in hand, because our common values, where the sense of dignity and human life are paramount. Together, we will help Ukraine. Thank you, Brian.
Igor, thank you so much. The message will resonate with our audience very clearly, and the practical dimension of what it means to care for more than 1.5 million people, I think should not be lost on the European community, as well as always the border countries taking the burden much more deliberately than the rest of Europe. This has to change. Victor Mendoza, thank you so much for joining us also, and your patience to speak today. The floor is yours.
Thank you, Brian. And thank you, Active Citizenship, for the invite to speak today. I just would like to start by thanking Igor for this testimony, because it's while we sit in many countries across Europe and sometimes far from the situation, of course, in Poland and other neighboring countries, people live this situation on a daily basis much more intensively. So it's really emotional and to hear this testimony from Igor. And I also would like to thank the opportunity to speak, of course, to so many patients associations across Europe. It's not every day that we have this opportunity to show a little bit of the work that we do. Again, this topic about the impact of the war in the Ukraine is not the most, let's say, positive one, but an important one, where the industry, the pharmaceutical industry, is also providing a contribution. And I would like to say that from the first moment, the trade association that Beatrice is part of, Medicines for Europe, was very active right from the first moment, working with the Ministry of Health in the Ukraine to understand what are the needs there in terms of medicines, and working with the member companies to try to reply to those needs, right? To get those medicines where they are needed in the Ukraine and in the neighboring countries. Working with NGOs, working with patients association, working with different stakeholders across Europe to understand those needs, and then to get the supply of these medicines. And this is really the core about patient rights, patient access, even for these essential medicines, life-saving medicines that are so much needed. And if we want to continue to do this work, we need to make sure that the corridors, the humanitarian corridors, are open, and that the medicines can make their way to this region and to the patients that need them. The second thing that I would like to mention has to do with the contribution of my company, and I'm flagging this because I know that many other companies have done a similar effort to try to reply to this humanitarian crisis. And of course, our first concern was with our employees there in the Ukraine, helping them, the ones that wanted to get to neighboring countries, to help them to safety to neighboring countries, but also helping those that decided to stay and somehow continue to work on patient access on a daily basis, as we all know, on a very extreme conditions. We also focus on a partnership that we have a long-standing partnership with Direct Relief to donate medicines to the Ukraine. Direct Relief is specialist on replying to these humanitarian crisis situations, and there's the logistics in place to make sure that the help gets where it's needed. So we have done these donations through Direct Relief, and many of those medicines already made their way to Poland, but also to other neighboring countries and to Ukraine where they are needed. But the most, I would say, interesting thing was the reply that the Beatrice employees have given to this crisis. Not only financially in a donation program that we have set up and that the company matched the donations that were made by the employees, but also personally as individuals, welcoming in their countries, like Igor mentioned, welcoming in their homes refugees coming from the Ukraine, and trying to help with different associations in the ground in any way they could. And this was really emotional and interesting to see all this support that each individual person gave to try to minimize this of course horrible impact that we all see. The third point has to do with the impact that this will have, right? And we know that Ukraine has one of the highest burden in terms of drug-resistant tuberculosis. We know it's one of the countries where we see the increase on HIV, but many other diseases, right? And with 4.3 million refugees coming to Europe and especially to these neighboring countries, this will have an impact on healthcare systems, right? We need to find ways to provide these people, these patients, access to medicines, access to healthcare systems, to this disease like drug-resistant forms of tuberculosis that had very limited impact in the EU, but that potentially now we'll see more people with this disease coming to EU. So we need to find answers for these patients, for these people that are coming to Europe. And of course, the war also triggered disruptions in supply chains all across the world. This has an impact in terms of the medicine supply, but also, as we all know, has triggered an increase in inflation, and especially when we are operating on an off-patent market sector with very low margins and regulated prices, it's very difficult to cope with increases in energy costs, transport costs, disruptions in supply chain, and this might have an impact on patient supply of medicine. So my plea is also that we find a way to support the patients, invest on healthcare. I think we've learned through COVID, with so many people being deprived of access to healthcare systems, and now we combine it with this additional crisis, humanitarian crisis, and we need to have an answer, a European answer, and of course national answers in each country to these patients. Thank you.
Victor, thank you so much. A lot to unpack there, but extremely important points and a summary of where we need to go next as well. Just to point out that John has also posted some important links from key strategy documents. They're in the chat there as well, worth following up, particularly I think on the Beating Cancer Plan and the State of Health in the EU report as well there. Now we're pretty much on time. Just a couple of final remarks from Mariano to finish this for today, and then we'll wrap up. Mariano, back to you.
Thanks, Brian. I just want to thank all the panelists because in little more than 1 hour, they were able to highlight some additional topic not enough emphasized in the context of the conference of the future of Europe, talking about behind all of these heterogeneous but all relevant topics, we can identify, of course, the common need to reduce health inequalities, the common need to access care, but also I had the hope to guarantee more participation in the define of health priorities. And tomorrow we will discuss a little bit with some concrete example. Even the fund exists, like in the Next Generation EU, so the National Recovery Resilience Plans. What is the level of engagement to define priorities and to implement the priorities? For our side, this is clear that in this context, Europe must be able to guarantee peace and security. The common goal of healthy Europe cannot be separated from the absence of war, of course. In the second part of this year, we can probably follow the decision of the European institutions that will take some concrete commitments after the conference of the future. In this regard, from many parts, there is a need to lay the groundwork to start, after the next European election, a constituent phase to go behind the current treaties. This is something that has been already mentioned by the member of the European Parliament. I'd like also to know the health actors that are involved in this debate. In a pragmatic way, we'll try to do our part. Among the other topic today, it was highlighted the topic of advanced therapy medical product. It's a complex issue, probably not enough known among the public opinion. For the reason we have decided to commit ourselves in the way to realize a European training session to better define the patient's right to access and the patient right to innovation in this new challenging context. Is open to the leader of the association, like the ones that are connected today, and it is planned next 24th of May. So this is one of our next appointments. Another topic is what I have already mentioned at the beginning of this meeting. In the context of the conference, only 215 events on the topic of health have been organized in the member state. This was one of the topics with the lowest number of relative events. We have understood this signal also as the need to invest more in raising awareness to better contribute to the pursuit of the goal of global health, defined by WHO as a fundamental human right. And to this end, we are committed to drafting a global health charter focused on the three topics: health and well-being, environment, and social justice. More in general, to deepen the topics discussed today, we have agreed with our media partner, Health Europe, on a special issues that will be published soon. I would also like to take the occasion to mention our second media partner, the publisher, Science Publishing of the international peer-reviewed journal Advancing Health and Behavior, and that this conference has been realized with the unconditional support of Boehringer Ingelheim, Illumina, MSD, Teva, and Viatris, which I would like to thank. Please let me thank again all the speaker, the moderator, and the European Commissioner for the very powerful video message. We are finished, so we will resume always at 2:30 p.m. Central European Summertime, New York time in USA, Brian, just to be clear, tomorrow, with the second session that which will offer us the opportunity to reflect, to talk about the mission of health within the national recovery resilience plans, with the involvement also of the participation of Ministry of Health from Italy and France. Thank you all again, and stay safe. Goodbye from Rome, Italy.
Thank you, Mariano. You can join me for a late breakfast tomorrow morning. Otherwise, we will see you at 2:30 tomorrow. Don't forget to use the hashtags and comment tomorrow as well. I wish you a good afternoon. Take care. Thanks to everyone.
Thank you. Bye.
Bye-bye. Thank you very much.
Bye.
Bye.